Did you know that millions of people are walking around with a silent health problem, one that can drain your energy, affect your mood, and even impact your brain? And the worst part? Most people have no idea it's happening. I'm talking about vitamin B12 deficiency, a condition far more common than you might think. B12 is essential. Your body needs it to produce red blood cells, support brain function, and keep your nervous system running smoothly. Without enough of it, your body can't function properly, but because the symptoms often mimic normal aging or other health issues, they're easy to miss. In this video, we're uncovering 8 strange but serious warning signs that your body is begging for more vitamin B12. We'll also discuss who's at risk and, most importantly, how you can fix and prevent B12 deficiency before it seriously affects your health. Let's dive in. Understanding vitamin B12. Vitamin B12, also known as cobalamin, is a water-soluble vitamin that plays a vital role in red blood cell production, brain function, and nerve health. It's found naturally in animal-based foods like meat, fish, eggs, and dairy, and is stored in the liver, meaning a deficiency can take months or even years to show symptoms. But here's the issue: many people struggle to absorb it properly. Older adults naturally produce less stomach acid, making it harder to extract B12 from food. Vegans and vegetarians are at higher risk since B12 is mostly found in animal products. People with digestive disorders like Crohn's disease, celiac disease, or IBS often have trouble absorbing it, as do those who have undergone weight loss surgery. Even common medications like metformin for diabetes and proton pump inhibitors for acid reflux can interfere with absorption. Understanding these risks is key to preventing a dangerous deficiency. Number 1. Fatigue and weakness. Do you ever feel completely drained, even after a full night's sleep? Do simple tasks like walking up the stairs or carrying groceries feel way harder than they should? If you constantly feel exhausted, sluggish, or physically weak, your body might be desperately low on vitamin B12, and you may not even realize it. Vitamin B12 is essential for producing red blood cells, which transport oxygen throughout your body. When your B12 levels drop, your body can't produce enough healthy red blood cells, leading to anemia, a condition that starves your muscles, brain, and organs of oxygen. The result? Extreme fatigue, muscle weakness, and a constant feeling of being worn out. Even if you're sleeping well, you might wake up exhausted because your body simply isn't getting the oxygen it needs. But the fatigue doesn't stop there. Many people with low B12 also experience shortness of breath, dizziness, and brain fog. If you feel lightheaded when standing up or struggle to focus throughout the day, it might not just be stress or dehydration, it could be a sign that your oxygen-starved body is struggling to function. If you feel constantly drained, don't just brush it off as normal tiredness. Persistent fatigue, especially if it doesn't improve with rest, could be your body's way of screaming for more B12. The best way to know for sure? Get your B12 levels checked. If you're deficient, increasing your intake through food or supplements could be the simple solution you need to regain your energy, strength, and mental clarity. Don't ignore the signs, your body depends on it. Number 2. Mood changes, anxiety, and depression. Have you been feeling more irritable than usual, struggling with mood swings, or battling anxiety and depression for no clear reason? It might not just be stress or life circumstances. Your body could be low on vitamin B12. B12 plays a critical role in brain health because it helps produce serotonin, often called the feel-good hormone. This neurotransmitter regulates mood, emotions, and overall mental well-being. When your B12 levels drop, so does serotonin production, leaving you feeling anxious, irritable, and even depressed. The frustrating part? Most people don't associate their mental health struggles with a simple vitamin deficiency. Instead, they assume they're just dealing with everyday stress or emotional ups and downs. Low B12 levels don't just affect your mood, they can also lead to a sudden lack of motivation, increased emotional sensitivity, and difficulty managing stress. You may find yourself feeling overwhelmed by small things, snapping at loved ones, or experiencing unexplained sadness. If you're normally a positive, balanced person but suddenly feel off for no clear reason, it might not be just in your head, your brain may be crying out for more B12. So, what can you do? Start by improving your diet. Foods rich in B12, like eggs, fish, dairy, and lean meats, can naturally boost your levels. But if you're vegan, vegetarian, or have trouble absorbing B12, you may need a supplement to restore balance. If mood swings, anxiety, or depression persist, consider checking your B12 levels, because sometimes a simple nutrient boost can make all the difference in how you feel every day. Number 3, pale or yellowish skin. Have you noticed that your skin looks paler than usual or even has a slight yellowish tint? If so, your body might be low on vitamin B12, and your skin is showing the warning signs. Here's what's happening inside your body. Vitamin B12 is essential for healthy red blood cell production. When levels are too low, it leads to a condition called megaloblastic anemia, where red blood cells become large, fragile, and prone to breaking down too quickly. As these cells break apart, they release a yellow pigment called bilirubin, the same substance responsible for jaundice. This can give your skin a pale or yellowish appearance, making you look sickly or fatigued, even if you feel fine otherwise. But that's not all. A B12 deficiency can also affect your skin's overall health. If you've noticed dark circles under your eyes, dryness, or thinning skin, these could be additional clues that your body isn't getting enough B12. Many people assume these changes are just due to aging or lack of sleep, but in reality, your body could be crying out for more of this essential nutrient. If you notice persistent paleness or yellowish skin, don't ignore it. Get your B12 levels checked, especially if you have other symptoms like fatigue or dizziness. A simple blood test can confirm whether B12 deficiency or anemia is the cause. If your levels are low, increasing your intake of B12-rich foods or taking supplements could help restore your skin's natural, healthy glow and improve your overall well-being. Number 4, glossitis and mouth pain. Have you ever looked in the mirror and noticed your tongue looks unusually red, swollen, or even smooth? Maybe you've been experiencing pain while eating, drinking, or speaking, or you've developed small, irritating mouth ulcers. If so, your body might be desperately lacking vitamin B12, and your mouth is one of the first places to show the signs. Vitamin B12 is crucial for maintaining healthy oral tissues, and when levels drop, your tongue and mouth suffer first. A deficiency can cause glossitis, a condition where the tongue becomes inflamed, swollen, and painful. Instead of having its normal rough texture, it may appear shiny, smooth, and red. This can make eating uncomfortable, cause difficulty speaking, or even leave you with a burning sensation in your mouth. But that's not all. Low B12 can also lead to painful cracks at the corners of your mouth, making it difficult to open your mouth without discomfort. Some people even experience mouth ulcers that make chewing and swallowing painful. Since vitamin B12 plays a role in tissue repair, a deficiency can prevent these small wounds from healing properly, making them persist longer than usual. If you've been dealing with any of these mouth-related symptoms, don't ignore them. They could be a clear warning sign of B12 deficiency. Try increasing your intake of B12-rich foods like fish, eggs, dairy, and meat. If you're vegan or vegetarian, consider fortified foods or a B12 supplement. And most importantly, watch for other deficiency symptoms, because catching B12 deficiency early can prevent serious long-term health issues. Number 5, tingling and numbness in hands or feet. Have you ever felt that weird pins and needles sensation in your hands, feet, or legs, even when you haven't been sitting in an awkward position? Do your limbs seem to fall asleep more often than usual? If so, it might not just be poor circulation. Your body could be telling you that you're low on vitamin B12. Vitamin B12 is essential for your nervous system because it helps produce and maintain the myelin sheath, a protective coating around your nerves. Think of myelin like the insulation on an electrical wire. It ensures that nerve signals travel smoothly and efficiently. When your body doesn't get enough B12, this insulation starts breaking down, causing nerve damage and leading to strange sensations like tingling, numbness, and even burning pain. But it doesn't stop there. If left untreated, B12 deficiency can lead to more severe neurological symptoms like balance issues, trouble walking, and muscle weakness. Some people experience difficulty coordinating their movements, making them feel clumsy or unstable on their feet. If the deficiency gets worse, it can even lead to permanent nerve damage, so it's important to take these warning signs seriously. If you notice persistent tingling, numbness, or unexplained weakness, don't ignore it. Get your B12 levels checked immediately. If a deficiency is confirmed, increasing your B12 intake through foods like fish, eggs, dairy, and meat, or taking a quality B12 supplement can help restore nerve health before serious damage occurs. Your nervous system depends on it. Number 6. Irregular heartbeat and shortness of breath. Have you ever felt your heart racing for no reason, or noticed a fluttering sensation in your chest? Do you find yourself getting short of breath, even with mild activity? These could be more than just random occurrences. They might be signs that your body is low on vitamin B12. Vitamin B12 plays a crucial role in red blood cell production. When levels drop, your body can't produce enough healthy red blood cells, leading to megaloblastic anemia. This means there's less oxygen being delivered to your organs and muscles, and your heart has to work harder to make up for it. The result is rapid heartbeat, irregular palpitations, and even dizziness or fainting. If this continues over time, the extra strain on your heart can weaken the heart muscle, potentially leading to more serious cardiovascular problems. You might also experience chest discomfort, lightheadedness, or a feeling of weakness, especially after exertion. If you're frequently experiencing a fast heartbeat, palpitations, or shortness of breath, don't ignore it. Seek medical attention immediately. A simple blood test can determine if a B12 deficiency is the cause. If confirmed, increasing your intake of B12-rich foods like fish, meat, eggs, and dairy, or taking a B12 supplement, can help restore normal oxygen levels and reduce the strain on your heart. Your heart is your body's engine. Make sure you're giving it the fuel it needs. Number 7. Memory loss or brain fog. Have you ever walked into a room and completely forgotten why you were there? Struggled to find the right words in a conversation? Or felt like your brain just isn't as sharp as it used to be? While occasional forgetfulness is normal, frequent memory lapses and brain fog could be a warning sign of vitamin B12 deficiency. Vitamin B12 is essential for brain function and cognitive health. It helps produce and maintain the protective myelin sheath around nerve cells, ensuring that brain signals fire properly. When your B12 levels drop, your brain struggles to process information, leading to memory problems, slow thinking, and mental fatigue. Some people even experience symptoms that mimic early dementia, which can be alarming, especially for older adults. But here's something surprising: B12 deficiency isn't just a problem for seniors. It can affect younger adults too, especially those who follow a vegan or vegetarian diet, have digestive issues, or take medications that interfere with B12 absorption. If you find yourself constantly forgetting appointments, misplacing items, or feeling mentally foggy throughout the day, your body may be lacking this crucial vitamin. If memory issues or brain fog are happening more frequently, don't ignore them. Get your B12 levels checked. A simple blood test can reveal if you're running low. If so, adding more B12-rich foods like fish, eggs, dairy, and fortified cereals, or taking a high-quality B12 supplement can help restore mental clarity, improve focus, and support long-term brain health. Your brain is your most valuable asset. Make sure it's getting the nutrients it needs to stay sharp. How to fix and prevent vitamin B12 deficiency. Vitamin B12 deficiency is completely preventable and treatable, but only if you take action. If you've recognized any of the warning signs, the good news is that boosting your B12 levels is easier than you think. The first step is to get tested annually, especially if you're at higher risk due to age, dietary choices, or medical conditions. A simple blood test can determine if you need to increase your intake through food or supplements. The best way to naturally raise your B12 levels is through a diet rich in animal-based foods. Meat, especially beef, chicken, and turkey, provides excellent amounts of B12. Fatty fish like salmon, tuna, and sardines are also great choices, along with dairy products such as eggs, milk, and cheese. If you can tolerate organ meats, liver is one of the most potent sources of B12, making it an excellent option for those looking to replenish their levels quickly. For vegans and vegetarians, getting enough B12 can be more challenging since it is primarily found in animal-based foods. However, you can still get B12 from fortified cereals, nutritional yeast, and plant-based milks like almond, soy, or oat milk with added B12. Even with these sources, many plant-based eaters still struggle to get enough, making supplementation necessary. If you're not getting sufficient B12 from food, or if your body struggles to absorb it, supplements are the best option. Methylcobalamin, the most bioavailable form of B12, is recommended for better absorption. Many people benefit from sublingual B12 tablets that dissolve under the tongue, while those with severe deficiencies may require B12 injections to restore healthy levels. Certain groups are at a higher risk of B12 deficiency and should seriously consider supplementation. People over 50 naturally produce less stomach acid, which is necessary for absorbing B12 from food. Those on medications like metformin for diabetes or proton pump inhibitors for acid reflux may also experience reduced B12 absorption over time. Additionally, individuals with digestive disorders like Crohn's disease, celiac disease, or IBS, or those who have had weight loss surgery, often struggle to absorb B12 properly. By making small, simple changes, you can protect your energy, brain health, and overall well-being. If you're experiencing any of the symptoms discussed, don't wait. Get your B12 levels checked and start increasing your intake today. Taking the right steps now can prevent serious long-term health complications and keep your body functioning at its best. If you've been experiencing any of these symptoms, fatigue, mood swings, tingling in your hands or feet, or even memory issues, don't ignore them. These could be warning signs that your body is crying out for vitamin B12, and catching a deficiency early can prevent serious long-term health problems. The good news? B12 deficiency is easy to fix with the right diet and supplements. Simply adding B12-rich foods or taking a quality supplement can restore your energy, protect your brain, and improve your overall well-being. If this information helped you, share it with others so they can check their B12 levels too. Don't forget to like, subscribe, and comment if you've experienced any of these symptoms. Let's spread awareness and help more people take control of their health.